So today we will take biochemistry. Now the very first question is about an enzyme which is associated with the deficiency of vitamin thiamine, or you can say which is used to assess the deficiency of vitamin thiamine. So thiamine act as a cofactor for one enzyme, and that is transketolase, right? And the form of thiamine is thiamine pyrophosphate. Clear? So it acts as a coenzyme for transketolase, especially in the RBCs, and therefore this RBC transketolase is considered as a marker for deficiency of thiamine, right? So just remember RBC transketolase as a marker of the deficiency of thiamine. So thiamine deficiency is diagnosed if we add thiamine pyrophosphate, that is TPP, and this results in increase in the red blood cell transketolase activity. Clear? So just remember few terms. The cofactor of thiamine, that is thiamine pyrophosphate, and that is needed for activity of transketolase, especially in the red blood cells, and therefore the red blood cell transketolase is taken as a marker for deficiency of vitamin B1, that is thiamine. Clear? So just remember this much. And this transketolase is very useful in the pentose phosphate pathway, right? Then moving forward, many times we have questions like there is some enzyme which is given and the cofactor is being asked, like for glutathione peroxidase the cofactor is selenium. Clear? So for glutathione peroxidase the cofactor is selenium. Then similarly zinc act as a cofactor for enzyme carbonic anhydrase, right? So zinc act as a cofactor for the enzyme carbonic anhydrase. So there are certain few important enzymes and their cofactors you need to remember, like there is one more like pyruvate kinase, for which the cofactor is potassium. Then cytochrome oxidase, the cofactor is copper, and for hexokinase the cofactor is magnesium. So just remember few important enzymes and their cofactors, right? Then moving forward, a 6-year-old boy was brought to the OPD by his mother, and he was born from consanguineous marriage. Now there is change in the color of the urine, and this is also evident as the mother noticed that there is dark black color on diapers when the when the urine is exposed to the external environment for a certain period of time. Now here you need to remember two important things. One is consanguineous marriage, and second is the change in the color of urine. And I think just looking at this particular option number 2, most of you can say that yes, this is a case of Alkaptonuria. So this is a classical description of Alkaptonuria, where the urine changes its color or it becomes dark on exposure to air. Now what does this word consanguineous marriage means? Like it means marriage between relatives. Clear? So marriage between relatives, and this holds very important especially in cases of autosomal recessive inheritance. Clear? So this is very important for autosomal recessive inheritance, where if the two parents are heterozygotes, like we can write it like this. So these are heterozygotes, and heterozygotes are always, carriers. They don't manifest the disease, they are simply carriers. But one out of such pregnancy will manifest the disease. Clear? And this is the one which will manifest the disease, because now this child is homozygous. Clear? So this is a classical term for autosomal recessive inheritance, consanguineous marriages. And another thing, I think most of you must be knowing that Alkaptonuria is because of deficiency of homogentisate oxidase. Clear? So one point which you can learn from here, that most of the enzyme deficiencies, they inherit as autosomal recessive pattern. Clear? So Alkaptonuria, Phenylketonuria, so all those conditions will have a autosomal recessive inheritance, and therefore consanguineous marriages is a risk factor. Anyway, for the questions, the moment you have this any option like dark color urine, the answer has to be Alkaptonuria. Clear? So there is deficiency of the enzyme homogentisate oxidase, and therefore there is no conversion of homogentisic acid into malonyl acetoacetate, and if there is no conversion of homogentisic acid into malonyl acetoacetate, it will convert into benzoquinone acetic acid, right? So this is the whole process in Alkaptonuria. Then moving forward, source of melanin. Now this sounds very easy question, but there is one more hormone, and that is melatonin, right? So this is melatonin. So both the hormones sounds similar, but melanin is synthesized from tyrosine. Clear? So this is from tyrosine, whereas melatonin comes from tryptophan. Clear? So you can remember the similar terms, TO here, TO here. So this is how I think you can understand that copycat. Good evening. So this is how I think this will help you in understanding like how to make sure that you don't mix up in such a easy question. So it has to be done right, and this is always a scoring and very favorite questions. Melanin coming from tyrosine. Now tyrosine is one amino acid which is giving rise to, or which is giving origin to many important hormones. One is of course melanin, then thyroid hormones. Clear? Then apart from this, catecholamines. So this is very important in that sense. So tyrosine is important. Now tyrosine itself is non-essential. Now this is very important to remember. It is non-essential. And why it is non-essential? Because it can be synthesized in the body, right? So it can be synthesized in the body. It means it is not required in diet. It is not required in diet. It can be synthesized in the body. Now the question is how it can be synthesized. The synthesis occurs from phenylalanine. Clear? So phenylalanine gave rise to tyrosine, and therefore tyrosine is synthesized in the body, and therefore we call it non-essential amino acid. And phenylalanine is, this is essential, this is needed in diet. Clear? So needed in diet. And this conversion of phenylalanine to tyrosine is carried out by one enzyme that is known as phenylalanine hydroxylase. Clear? So this is in short about tyrosine and related things. And just to stress again once again, melatonin, tryptophan. Please remember this, don't mix up with melanin. It's a pretty easy question, should not be done wrong at any cost. Clear? So tyrosine, we can see it is giving rise to thyroid hormones, it is giving rise to melanin, and it is giving rise to catecholamine. So tyrosine is very important and non-essential because it is derived from phenylalanine, and the enzyme involved in conversion is phenylalanine hydroxylase. Now there is one condition where there is deficiency of phenylalanine hydroxylase, and that condition is known as phenylketonuria. So this condition is known as phenylketonuria, and in such cases, since this enzyme is not working, so there is no conversion of phenylalanine to tyrosine. So what happens? There is increased levels of phenylalanine and there are decreased levels of tyrosine. So what we need to do? In such case, don't give phenylalanine, because already whatever the amount is present, it is not metabolized to tyrosine. So we don't give phenylalanine. But we just read that phenylalanine is needed for conversion to tyrosine. So if you're not giving phenylalanine, what do you need to do? You need to give tyrosine, or you need to supplement tyrosine. So give tyrosine in diet, because the usual mode of derivation of tyrosine is not happening. So we have to give tyrosine in diet, and therefore it becomes essential because we are supplying it in diet. Clear? So the condition where tyrosine becomes essential is phenylketonuria. Otherwise, in a normal subject, there is no need of taking tyrosine in the diet because phenylalanine is sufficient enough to get converted into tyrosine. Clear? So this is just correlated facts. Now moving forward, this thing we have already discussed. If tyrosine level in the body is normal and we are not giving anything from outside, it means it is derived in the body in sufficient amount, deficiency of which enzyme is ruled out. It means which enzyme is working properly. So we just discussed that phenylalanine is converted into tyrosine in a normal subject, and the enzyme which mediates this reaction is known as phenylalanine hydroxylase. Clear? So if this enzyme is working perfectly, then there will be sufficient quantity of tyrosine which is being derived from phenylalanine, and therefore we need not give any tyrosine supplementation from outside. And in case, like we have discussed here, if there is no PAH activity, that is phenylalanine hydroxylase activity, of course there is no conversion of phenylalanine to tyrosine, so we need to supplement it from outside. So if there is no supplementation from outside, tyrosine is in sufficient amount, it means phenylalanine hydroxylase is working perfectly. So deficiency of which enzyme we rule out? This is phenylalanine hydroxylase. Clear? So this enzyme deficiency is ruled out because it is converting phenylalanine into tyrosine. Moving forward. Okay, so here we can see phenylalanine is converted into tyrosine and the enzyme is phenylalanine hydroxylase. So the enzyme here is phenylalanine hydroxylase, and if this enzyme is deficient, then the condition which results is known as phenylketonuria. Clear? Then moving forward, a young male has hypermobility and hyperelasticity since childhood. Now, what is this condition? This is very characteristic. The moment you have this word hypermobility, hyperelasticity, this is nothing except Ehlers-Danlos syndrome. Clear? So this is Ehlers-Danlos syndrome, and this is how you can understand what is hyperelasticity. Right? So the patient can stretch the skin like this. So this is Ehlers-Danlos syndrome. Then moving forward, the best homeostatic mechanism. Now, what is this word homeostasis? Homeostasis. Now, homeostasis means there is an optimal working environment of the body, right? So, in simpler words, optimal working environment of the body. All the processes are working in harmony in an optimal manner. So that is homeostasis. Now, which homeostatic mechanism is necessary to counter hyperammonemia in brain? And this is actually because of transportation of ammonia from brain to liver. So suppose if this is brain, and if there is ammonia here, now this ammonia is very toxic. Clear? So this is very toxic. Now this ammonia has to be transported to liver so that it can undergo urea cycle. So this transportation has to take place, and this is helped by glutamine. Clear? So this transportation is helped by glutamine. So the best mechanism to counter means neutralize. Counter means neutralize. Hyperammonemia means increased ammonia in blood, in brain tissue, and this is with the help of glutamine. So glutamine here is very important because it removes the toxic ammonia from the brain. It transports it to liver, where it can be converted into least toxic substances like urea. Clear? So this is very important for ammonia excretion or ammonia detoxification, you can say. Now moving forward, the RNA contains a coding sequence as CAAGGU. The sequence of DNA from where it will be transcribed would be. Now what is this word transcribed? Now transcribed is taken from the word transcription, and transcription means DNA to RNA. Clear? So DNA to RNA, or you can say synthesis of RNA from DNA, that process is known as transcription. This is one thing, right? So it means we are having the RNA sequence, and that is like C, A, G, G, and U. Now we have to put the DNA sequence from which this RNA sequence will be, taking place. Now here you need to remember few things. In DNA, just couple of things. In DNA, A pairs with T and G pairs with C. Clear? This is in DNA. And in RNA, T is replaced by U. Clear? So T is replaced by U. So these are the two facts. Very good, Dr. Puneet. So these are the two facts which you need to keep in mind. Now here, we know that C will pair with G. So here we can write G. A will pair with T. Again, A will pair with T. G will pair with C, again G will pair with C. Now here the term is U. So U can be taken as it can be taken as T for DNA, and T will pair with A. Clear? So the important thing which you need to remember here is the base pairing rule. Okay. Number one, you should remember the base pairing rule. A with T, G with C. Right. Secondly, in RNA, you have to replace T with U. Now here there is one more easy way of getting the answer. What you can do, you can think of the process known as replication. Now replication is what? Synthesis of DNA strand from DNA. So here we can write the sequence like G will pair with C, T will pair with A, T will pair with A, C will pair with G, C will pair with G, and A will pair with T. Okay, so this is one way of getting the complementary DNA strand first. Clear? So this is a DNA strand. Now if we want to convert into RNA, what we need to do? We need to replace all T's with U. So in this sequence, there is only one T which is coming. So we will replace it with U, and then you can get your complementary RNA strand. So that is another way. So it's all up to you how you get to the answer. There are two methods. Either you can take this these two rules of base pairing in DNA and RNA, or you can do the replication thing first and then replace all the T's with the word U. So you'll be absolutely right. So Dr. Puneet, you are very good in that. Perfect. So the answer will come out to be GTTCA, as what Dr. Puneet has already mentioned. Now moving forward to a question like a wrong statement about collagen. Now I think most of you must be knowing that collagen is the most dominant protein in the body. Now here in bones, tendon, especially, it is type 1. Clear? So bones and tendons, it is type 1. Now here how you can remember? For type 1, you can write like this. Okay. So you can take this ON in these structures. So that way you can remember that in type 1, the type 1 is most commonly seen in bone and tendons. So if you find this kind of statement, you can straight away go and you can say that this statement is wrong, because in tendon it is type 1 collagen. Clear? So this is type 1 collagen, which is principally seen in bones and tendons. Type 2 is present in cartilage. Clear? So type 2 is present in cartilage, type 3 in blood vessels, and type 4 in basement membranes. So for type 1, you can remember bone, tendons, skin dentine, type 2 in cartilage, type 3 in blood vessels or fetal skin, and type 4 you can remember basement membranes, and type 5 in placenta. So very important to know about type 1 at least, right? Then moving forward to a question about maple syrup urine disease. Maple syrup urine disease, and here there is defective metabolism of 3 amino acids, and you can remember the mnemonic as LIVE. So L for leucine, then I for isoleucine, clear, and V for valine. So these are the 3 amino acids whose metabolism is defective in maple syrup urine disease because of deficiency of branch chain alpha keto acid dehydrogenase, right? So just remember LIVE. leucine, isoleucine, and valine. For maple syrup, urine disease, where the smell of the urine is like burnt sugar, right? So in simpler words, you can write here burnt sugar urine, which is one very important keyword in getting the diagnosis as maple syrup urine disease. So in maple syrup urine disease, leucine, isoleucine, and valine metabolism is affected because of deficiency of branch chain alpha keto acid dehydrogenase, right? So this is one thing. Now a mother noticed that the urine of the child changes to dark color on long standing. So the moment you have this word urine, dark color on exposure to atmosphere, I think most of you can answer it at first sight. This is nothing except Alkaptonuria. Clear? So in such cases, in such questions, don't waste your time. The moment you have these keywords, search for the option, mark it right, and go ahead. Don't explore other options or don't waste your time unnecessarily. Fine. Then a protein specimen was heated as at 100 degrees Celsius. What structure will not be denatured or will not be destroyed? Now, I think most of you must be knowing that there are few different types of structures, so primary, secondary, tertiary, and quaternary. Now, when you heat a sample, these all type of proteins, they will be destroyed, they will be denatured. It is only the primary type which remains as such. And what is the primary type? There are peptide bonds, and these peptide bonds are actually linking the amino acids. So you can say these are polypeptide chains. So these are all amino acids and these are the peptide bonds, right? So this is the primary structure and it remains as such. It does not denature even if the protein sample is heated to 100 degrees Celsius. Clear? So primary structure stays as such. Rest, they get denatured. Now moving forward, a 4-month-old child presents with refusal of breastfeeding, and it was noted that there is hypoglycemia, there is ketosis, and smell of burnt sugar in the urine. Now, the moment you have this particular keyword, there is no need to look at the other things in the question statement. So, smell of burnt sugar, this is maple syrup urine disease, and for maple syrup urine disease, the enzyme deficient is branched chain alpha keto acid dehydrogenase. Clear? So this is, and we have already discussed which amino acids metabolism is defective. So remember that mnemonic, live. Fine. Leucine, isoleucine, valine. So this is classical for maple syrup urine disease. Then moving forward, a woman presents with palmoplantar pigmentation, and there is also calcification of intervertebral disc. And when Benedict reagent was added to the urine sample, there is formation of blue-black supernatant fluid and a greenish-brown precipitate. Now, what is the most likely diagnosis? There are three important keywords: pigmentation, then calcification of intervertebral disc, and Benedict reagent showing a blue-black supernatant fluid. Now here, if you remember, like especially in Alkaptonuria, there is deposition of black pigment in the connective tissues. Like it can get deposited in the pinna, or there can be calcification of intervertebral disc. You can also correlate one term, ochronosis. So this is all classical for Alkaptonuria. And on addition of the Benedict's reagent, we can see a dark color supernatant. So a dark color supernatant precipitate. Clear? So this is in short about Alkaptonuria. Then moving forward, this is just one more repetition of the question which we have already discussed. So ammonia in brain is finally converted into. Now this is finally converted into, it is taken to the liver where it undergoes urea cycle. And this is transported by the way of glutamine. So glutamine is an important transporter for the ammonia which is formed in brain, because this ammonia is very toxic and it has to be handled at the earliest. So ammonia by the way of glutamine transported to liver where it is excreted in a non-toxic form. Now moving forward, child has frequent attacks of convulsions and unconsciousness. There is poor intake of food, loss of weight just because of poor intake of food. There is difficulty in learning and fatigue. And on urine examination, there is formation of a purple ring and a positive Rothras test. And when plasma levels of leucine were checked, they were really high. Now, what is the diagnosis? Now, if you look here, going with the question statement, it seems that it's a very difficult question and very difficult to reach up to the answer. Now, here you just note one thing: the level of leucine are high. It means there is defective metabolism of leucine. And we just discussed one condition where there is defective metabolism of leucine, and that is maple syrup urine disease. So apart from leucine, isoleucine and valine, these are also not properly metabolized. So just getting this one particular word, you can reach up to the answer of maple syrup urine disease. Okay, so this is a classical presentation for maple syrup urine disease, where there is defective metabolism of leucine, isoleucine and valine. So this is very important. And in Rothras test, which suggests ketosis, we can see a purple colored ring. So this is suggestive of ketosis or ketone bodies. Clear? So this is in short about maple syrup urine disease. Fine. Next question is again about first degree consanguineous marriage. Now the moment you find the word consanguineous, think of a condition is going to be a autosomal recessive inheritance, and in a broad manner you can think of enzyme deficiencies, because these are actually inherited as autosomal recessive diseases. So here if you go forward, there is backache, then joint pain, everything is normal. Urine microscope is also normal, but when we keep the urine for some time, it developed black color. So the moment you have this urine black on exposure to atmosphere, I think most of you can again answer it absolutely correct. This is nothing except Alkaptonuria. And also, not only this particular word, this also was already telling us that we are going to answer, or we are going to see some enzyme deficient condition, and here the enzyme deficient is homogentisate oxidase. Clear? So this is how you can correlate the facts given in a question. And yes, you have to always look for that short keyword which alone is sufficient to take you up to the answer, right? So in this question, this is urine sample turning black on exposure to atmosphere. Now, which of the following occurs in cytoplasm? Now, to answer this kind of questions, you have to look at the options first. So like Krebs cycle, it occurs only in mitochondria, and you must have heard like this does not occur in RBC. Why it does not occur RBC? Because RBC lacks mitochondria. They don't have mitochondria, so how this cycle can occur there? So this is one thing for Krebs cycle or tricyclic acid cycle. So this is nothing except the Krebs cycle. Now, gluconeogenesis and urea cycle, these are two pathways which occur at two sites. Two sites means both cytoplasm as well as mitochondria. So please remember them nicely. Gluconeogenesis, that is formation of sugar from non-sugar sources like lactate, pyruvate, alanine, and urea cycle, these two are occurring at both the sites. Now the only one of the option which is occurring exclusively in cytoplasm is glycolysis, that is breakdown of glucose into pyruvate or lactate depending on the aerobic or anaerobic conditions. Clear? So the answer is glycolysis here. So again, you can take few important both cytoplasm and mitochondria. Please remember two conditions: gluconeogenesis and urea cycle. And for cytoplasm, you can remember glycolysis, that is EMP pathway, then fatty acid synthesis, glycogenesis, that is formation of glycogen, then glycogenolysis, that is breakdown of glycogen. Clear? So, and for mitochondria, yes, you can remember Krebs cycle, that is TCA cycle or citric acid cycle, then electron transport chain which occurs on the inner mitochondrial membrane, and ketogenesis, that is formation of ketone bodies. Clear? So you can just remember few important pathways and their site of occurrence. Now moving forward, insulin increases activity of all the following enzymes except. So it means we have to answer one enzyme which insulin does not like at all or which insulin does not favor at all. Now to answer questions like this, firstly you have to understand what is the action of insulin. Now insulin tries to reduce blood sugar. Clear? So it tries to reduce blood sugar level. So obviously it will never prefer an enzyme which is trying to increase the blood sugar levels, and that enzyme is actually pyruvate carboxylase, because pyruvate carboxylase is needed for gluconeogenesis. And this is actually formation of new sugar molecules from non-sugar sources. That's very important, from non-sugar sources. Okay, so we can write like non-sugar sources. So here insulin will not, because insulin inhibits, right? So insulin inhibits gluconeogenesis, so it will never favor an enzyme which is participating in this particular pathway, right? So therefore insulin will never increase the activity of pyruvate carboxylase, which is needed in the formation of or in the process of gluconeogenesis. So this is always inhibited by insulin. Moving forward, infant has severe hypoglycemia, very low blood sugar levels, enlargement of liver, hepatomegaly, increase in uric acid level, that is hyperuricemia, and lactic acidosis. And when liver biopsy was done, it shows normal structured glycogen deposition. And in fact, this deposition of glycogen is leading to enlargement of the size of liver, that is known as hepatomegaly. Now, which enzyme is deficient here? It means normally what happens, like excess glucose is stored as glycogen. Clear? And when there is need, this glycogen is again broken down into glucose. So this pathway is known as glycogenesis. There is formation of glycogen, and this pathway is known as glycogenolysis. Right? So this is glycogenolysis, breakdown of glycogen. Sorry. So what happens? Suppose if there is any enzyme deficiency and this pathway does not occur, there will be increased amount of glycogen, especially in liver, that will lead to hepatomegaly. And since there is no formation of sugar, so there will be hypoglycemia. Clear? And this can divert into formation of uric acid, so there will be excess uric acid. So this all happens in GSD1, that is von Gerke's disease. So see, this glucose 6-phosphatase has to be converted into glucose by the enzyme G6P, that is glucose 6-phosphatase. And if there is deficiency of this enzyme, the condition is known as glycogen storage disease 1, especially A, and that is von Gerke's disease. Clear? So it means there is no formation of glucose, so glucose levels will fall down, so there will be severe hypoglycemia. This glucose 6-phosphatase, since it is not diverted for conversion to glucose, so it will go somewhere else into the pentose phosphate pathway, and it will finally form uric acid, and there will be hyperuricemia. Clear? So severe hypoglycemia, hyperuricemia, enlargement of liver because of deposition of glycogen. This is classical glycogen storage disease 1A, that is von Gerke's disease, which is because of deficiency of glucose 6-phosphatase. I think you have read these questions many number of times, and it is one of the important type of glycogen storage disease which is being asked. Now, moving forward, enzyme deficient in classic galactosemia. Right? Now, galactosemia means there is increased galactose in blood. And this means that the galactose is not broken down. Right? So there are different enzymes which are involved in breakdown of galactose. And if we talk about classic, this is GALT. Clear? So the classic is GALT, and this is galactose 1-phosphate uridyl transferase. So this is galactose 1-phosphate uridyl T from transferase. Right? So this is the enzyme which is deficient in classical galactosemia. Apart from this, there can be deficiency of GALC or GALE, right? But please remember GALT for classical galactosemia. Right? Moving forward to next question. A neonate on breastfeeding develops jaundice and cataract, and urine Benedict's test is positive. Now see, neonate breastfeeding having problem, it means the neonate is not able to digest galactose, because what is present in the breast milk? So it means there is some problem with very good Pratik Mane, very good. So yes, you can remember it as galput or galt, right? So it means the neonate is not able to tolerate breast milk and therefore is having jaundice and more importantly cataract. I think most of you must be remembering that this is oil drop cataract. So the moment you have this word, I think this is sufficient enough to take you up to a diagnosis of galactosemia. So increased galactose in blood. And Benedict test is positive. It means there is presence of reducing substance in urine, and galactose is one such reducing substance. So this is a classical way. The moment you find this cataract, neonate, difficulty with breastfeeding, always think of galactosemia. And here this is actually classic galactosemia. So here you will see jaundice, vomiting, lethargy, poor feeding, and importantly cataract. So this is, in fact, you can write it as classic galactosemia. Clear? So this is classic galactosemia, and this is because of deficiency of galt. Because we can see galactosemia with deficiency of galc or gale, but they don't have these much of symptoms. So this is all suggestive of galt, that is galactose 1-phosphate uridyl transferase. Very good, Pratik. Moving forward, a lady presented with bone pain and enlargement of liver and kidney. So there is enlargement of liver and kidney, and when the specimen was taken from spleen, we saw crumpled tissue paper appearance. Now I think the moment you have this particular word, crumpled, Pratik Mane, absolutely right, because the baby is not able to tolerate breastfeeding, so stop breastfeeding. Very good. Now crumpled tissue paper, I think the moment you have this word in your mind, the answer is absolutely yes, Pratik, very good. The answer is Gaucher's disease, which is a type of lysosomal storage disease. Now what happens here, there is deficiency of the enzyme glucocerebrosidase, right? So there is deficiency of glucocerebrosidase, right? So there is deficiency of glucocerebrosidase, and therefore what will be accumulated? There will be accumulation of glucocerebroside, right? So there is deficiency of glucocerebrosidase and there is collection or accumulation of glucocerebroside. So this is the substance which is accumulated in Gaucher's disease, glucocerebroside, because there is deficiency of glucocerebrosidase, which converts glucocerebroside into ceramide, right? So this is for, please remember this, for Gaucher's disease, which is the most commonly asked lysosomal storage disease. Moving forward, neonate after birth suddenly becomes lethargic, starts refusal of breastfeed and vomits during forced breastfeeding. Then the child also had developed diarrhea and there is oil drop cataract. Now here, even if you don't have this word oil drop cataract, just take this point. Neonate is not tolerating breastfeeding, so he tried to refuse breastfeeding, and if the mother forcibly breastfeed her, then the child will vomit, and also child will not tolerate, leading to diarrhea, and because of inadequate nutrition the child is becoming lethargic. So this all suggests that there is some problem with milk digestion. Milk means breast milk. So the child is not able to tolerate the breast milk. So the moment you have this kind of presentation where the child is not accepting the breast milk or is not able to tolerate that, think of the entity that is galactosemia, right? Because breast milk is having galactose. So this condition is galactosemia. And if you have plenty of findings, lethargic, failure to thrive, vomiting, diarrhea, this is always a classical presentation of classic galactosemia. Remember, classic galactosemia has a lot of manifestations, which, and this is, we already discussed, this is because of deficiency of GALT, galactose 1-phosphate uridyl transferase. Clear? So this is a very beautiful presentation of a case of galactosemia. So the classical galactosemia, where the conversion of galactose 1-phosphate to glucose 1-phosphate could not occur. So this is the reaction, galactose 1-phosphate to glucose 1-phosphate. It means there is defective conversion or defective metabolism of galactose. The child is not, the newborn is not able to tolerate galactose because the enzyme which is needed for conversion is deficient. It is not working. So this is the presentation for classic galactosemia, that is type 1 galactosemia, right? Apart from this, there are many other GALM or GALC, but these are rarely asked. So one should be very good with the classic galactosemia, deficiency of GALT, and you can see a classical presentation, right? So this is enough for this session. I am very sure you must have enjoyed the session. Very shortly, I'll come back with another subject. Till then, keep on studying. God bless. Bye-bye.